Dear doctors, this is Dr. Luis Carriere from Barcelona, and I would like to explain you today the reason why when I invented the Carriere Motion appliances, the Carriere Motion Original, the Carriere Motion Pro, why I did them side specific, why I did them right and left, why I split it in two types of appliances, the right one and the left one. Today, in the market, we can see appliances that are imitations of the Carriere Motion that are universal. Why universal? Why site-specific? This is tremendously important in terms of long-term stability and in terms of amount of rotation of our molars. The long-term stability is all about the perfect position of the molar, perfect distal rotation and perfect uprighting or the uprighting of the molars. If we upright properly and rotate distally the molars, we will have long-term stability of the sagittal part of our patients. And the Carriere Motion appliance is an appliance that has tolerance to be positioned on mesial inclined molars. The posterior base has tolerance to be positioned on the mesially inclined molars, and then when we upright the molars, this uprighting will generate a space mesial to the molars. This space mesial to the molars is a necessary step to start the rotation of them. Without uprighting of the mesially inclined molars, we are not going to without uprighting, we are not going to be able to rotate, because if we compare occlusally, the same maxilla with a mesially rotated molar or a distally rotated molar, we will see that the distance in between the canine and the buccal surface of the molars is going to be different. And we know that the Carriere Motion appliance, or any appliance out there that it can be universal or site-specific, are not elastic, are rigid. And in order to be able to accomplish a correct rotation, we need to release space mesial to the molars in order to be able to squeeze the distance, in between the canines and the molars. And for that purpose, once shortened the distance in between the canines and the molars, we will be experiencing distal rotation of those molars. So it's extremely important that you understand that the Carriere Motion appliance was created site-specific, not for any purpose that has no sense, was created in order to accomplish correct rotation and correct position. A mesially inclined molar pushes the premolars and canines back into class II in every bite. A correct uprighted molar and distally rotated establishes a peaceful scenario of class I for the canines and premolars, and then the long-term stability is granted, as you see in our lectures of 16-year follow-up, 19-year follow-up of our cases with an extremely consistent occlusion in class I. Hope you like it, and see you soon.